So we are going to our next speaker, Dr. Ammar Abdelhadi, pediatric attorney at Royal Stock University Hospital, West Midlands, UK. Dr. Abdelhadi has strong experience in training system and how applications are being assessed, and he's going to give us practical tips on how to apply for ST3 Paediatrics. So over to you, Ammar.
Hello guys, can you see my screen first?
Yes, we can, yeah.
Amazing. And the next step is to see if they are actually working. Sorry, I'm not very good with, obviously, with the begin. Yeah. Can you see it like moving?
It is moving, Dr. Ammar.
Amazing. So my name is Ammar Abdelhadi. I am a pediatric trainee in West Midlands Deanery, and I used to be SAS doctor or senior specialty doctor in pediatrics in some of the West Midlands hospital. And I'm going to talk today about obviously applying for ST3 pediatric training. I'm aware of the time constraints. I know that I have got only 30 to 35 minutes as per Dr. Mahmoud. But I just wanted to say that obviously I'm so happy that I'm speaking with you guys today. And I wanted obviously to thank Dr. Mahmoud for giving me the chance to speak today to you. I know that obviously ST3 pediatric training is quite competitive, but it is obviously doable. This kind of presentation is based on the RCPCH official guidance, and I can leave you obviously the link in the comments so that you guys can obviously go through all of these lovely resources and you can read for yourselves. Today I'm only giving, as per the title, a bit of tips, a bit of nuggets, and some strategic insights. Not obviously everything, because this will take long time to go through. So the aim of this presentation is not only to cover like the ST3 pediatric application, it is just to prepare you for the application. I used to think that applying for pediatric training, whether it was ST1 or ST3, it's just like a decision that I can take like 1 or 2 months before the application window open, but actually this is not right. You should be ready, you should be prepared for at least 6, 7, 8 months before obviously the window opens, so that you, whenever the window is open, you can actually show and sell your kind of like what you have done over the past few years or months. So we will be going through the ST3 recruitment process, and we will be going through the eligibility and requirements, and we will be talking about shortlisting and interview scoring, and we will give a bit of practical preparation tips. And I wonder if Dr. Mahmoud can please give me a shout regarding obviously the time, because again, I like to talk a lot. ST3 is now the only higher level entry point. So basically, to enter the pediatric training, and we will come to that in a second, you can enter the pediatric training at ST1 level, and then you follow the pediatric training till ST7 till you get your CCT. Or there is a higher level entry point, that is ST3. Previously, it used to be ST3 to ST4, but since 2024, this has changed, and this is only ST3 is the only higher level entry point at the moment. And as I mentioned, it is quite competitive, but it is doable. And basically, ST3 posts may be available at 2 points, which is 2 times per year. But actually, mainly it happens over National Round 2, which is basically in November. Some posts might be available in National Round 3, but it's not always the case. When I started in the UK, back in the days, I used to think that I am going to follow CSR pathway. I did have quite a bit of experience back home in Egypt in pediatrics and neonates. And I wanted to take this experience forward and continue doing CSR because of obviously some circumstances like family circumstances and so on. And I'd always had this dilemma. Whenever there is like a window for pediatric training, I always ask myself, should I apply now should I continue my CSR pathway? And obviously, to answer this question, you have to go through a bit of checklist about your personal circumstances, about your career motivation, about what would you like to do in the future. I think I have chosen to enter the pediatric training mainly because of career motivation. But obviously, if you are in a hospital that supports the CSR pathway or portfolio pathway, go for it. You will get to the specialist register at the end of obviously your application for a CSR. And I know that Dr. Gouda has got like lovely presentation about CSR, so I'm not going to talk about it. So that's the pediatric training timeline. So basically, the pediatric training is 2 phases. The first one is the core pediatric phase that starts from ST1, ST2, ST3 to ST4. And the other phase is specialty pediatrics or higher specialty training. That's ST5, 6, and 7. Previously, the pediatric training used to be ST1 to ST8. Don't get confused with that. Just it is now 2 phases, core pediatrics and higher specialty training. So from the core pediatrics point of view, the pediatric doctors start at ST1 and ST2. That's on tier 1 rota. That's basically junior doctor rota or senior house officer rota. In some hospitals, ST3 is especially if you have got the experience, you can actually work on the registrar rota, and with this is what I have done. But obviously, in other hospitals, you will be on the SHO rota, which I also have done. So in 6 months, I worked on registrar rota, and then when I went to another hospital, obviously this was like quite a new environment for me. I said I'm happy to be on the SHO rota. So ST3 can be either way. ST4 you will be on registrar rota, and the rest obviously with the higher specialty pediatric training ST5, 6, and 7. You can go for SPIN, that's special interest in some subjects, or you can actually go to a grade pediatric training, which is a whole kind of like a talk. We will not be talking about it now. We will be focusing on the obviously ST3 application process. Am I talking too fast?
No, right. Dr. Omar, you can carry on. Yeah.
Thank you. So who should apply? Anyone really with pediatric experience, and you need to be honest with yourself and make sure that you are actually ready to work as ST3 level, because as I mentioned, some places ST3 is on the registrar rota, and being a pediatric or neonatal registrar in the NHS is not an easy job to do. You have to be ready. You have to know what the SHO needs to do, and you can at nights you're actually on your own. You have got the consultant to call. They are 15, 20, 30 minutes away from you. So you have to have obviously the basics, and you have to have the required experience to work as ST3 if you are going to be on a pediatric kind of registrar rota. The recruitment timeline, and this is basically mainly on round 2, which has happened last November, December, and it is actually at the moment at the shortlisting kind of like phase. So the application will open anywhere between mid-November to mid-December, and then it will be like long listing kind of process. That's to exclude people who hasn't actually achieved the personal specification for the job. For example, someone who doesn't have GMC registration, or someone who doesn't have the correct kind of like core pediatric capabilities certificate signed off correctly by the consultant, which I'm going to obviously focus on because it is quite important to make sure that it is signed off correctly. Otherwise, you're not going to the next phase, which is shortlisting. The next one will be interviews, and after that, it will be offers. It will be released in April. The whole kind of like application is 2 stages, and you have to be ready for at least the first stage first. So you do not worry about obviously the interview. The second stage, you can obviously prepare and become quite prepared, but you have to focus initially on the application form. There are white space questions for shortlisting, They are covering your past achievements, your teaching, your management, your clinical experience, your leadership, your research, your things like that. And these applications are made on a website called Oriel. The second stage is a 40-minute virtual interview, and this is basically made of two stations, 17-minute station each, and we will come to that at the end. I'm not going to go in details in terms of everything you need to do, but to be honest, this is one of the most important steps you have to focus on at the start. Because if this one is not correctly done, even in one part of it, you will not be long listed. And I have seen brilliant doctors that they have applied for pediatric training. They did amazing job. They have got all the kind of like requirements. They have done teaching. They have got research. They have got this and that. But they were not even long listed because the certificate was not complete. So it was quite a bit of kind of like disappointing for them, really. So please focus on this part because this is quite important. So the instruction that you will find on the core pediatric training capabilities certificate, that this should be signed only by a consultant. It's not a registrar. It is not a SAS doctor. It should be a consultant. It doesn't matter if this consultant is working in the UK or wherever they are working, but they have to be consultants and they have to attach their kind of like a proof of being a consultant to this certificate if they're not working in the UK. And this consultant, you have to work with them for at least 3 months. So you can't really like you know this consultant for the last 30 days or 2 months, and they can't sign your this certificate. They have to be at least 3 months working with you. And we will continue with obviously with this instruction. You have to complete every and single bit in that certificate. I was lucky, to be honest, and I have to confess that I made my certificate extremely kind of like, I was very cautious with it. I filled everything. However, there was like a very tiny part that I forgot to sign. That's the applicant kind of declaration, that this is my name and that's my GMC number. I was lucky because they have emailed me saying that, can you please look into this and sign it and obviously send it back to us. And you have to do that by Friday midday. So what happened is I only looked at this email like Thursday kind of night.
Sorry to interrupt you. I'm not sure if your slides are moving or you are on the same slide.
Yeah, can you see it moving now?
Yeah, now, yeah. So we were not able to see it before.
Sorry. So yes, you have to make sure that it is complete. Otherwise, if I didn't look at obviously Thursday night, I wouldn't be long listed. So that's really important. So we'll go to the next bit, and again, it is really important to make sure that the consultant sign this bit. That is the app. Obviously, so that's the applicant declaration that I was talking about. Don't forget to sign the applicant declaration. That's where you write your name, your GMC number, and this is the signature. And again, incomplete form means that you are not going to be long listed. And this is for the consultant to sign. They have to tick all these boxes. I'm not sure if you can see them, but they have to tick all these boxes. They have to put their signature, their print name, their date, and if they're working in a hospital, if you can get obviously a hospital stamp if they are not working in the UK, and then an email address for your institution. Like it is important for them to put like a work email. But I have seen some situation where it was signed by a consultant who put his like personal email and it worked. But what is written here, literally, you have to get like kind of like work email for them. So this is again for the consultant to sign. That's their name, their professional status, and their current post, and their address, and their email address, and then obviously the GMC number if they are working in the UK. If they are not working in the UK, they have to put their designated or registering body, the registration number, and they have to attach that photocopy of their professional status. So in one of my colleagues who applied this rotation, they have obviously a consultant who's working in Ireland. this consult, they did not attach a photocopy of their professional status of so that their kind of like certificate was rejected and they were not long listed. And they have to write your name again, your specialty, and they have to write when did they start to work with you from this time to this time, and obviously which country they're working in. The second step obviously is showing your neonatal and pediatric experience, and as per the guidance it says you must have at least 12 months of experience. That's basically and when we talk about 12 months, there is something called whole time equivalent. So you cannot be working as a 60% or 80%. It should be not like a 1 year calendar year. It should be like a whole time equivalent. So if you're working as 60% in a year, that's 60% of a year, if it makes any sense. And you have to continue, like if you are working for like 60%, you have to show that you worked at least for like 20 months, if that makes any sense. And you have to show that you have got 6 months in neonatology and 6 months in general pediatrics. And we are going to talk about that. So if you can see the applicant confirmation as well, that is where you put your experience in neonates and experience in pediatrics. And again, in the guidance, it is written you should show the neonatal experience at level 3. And level 3 means tertiary neonatal unit, or it should be at level 2 that you can actually show that you have achieved the competence that I'm going to show you in a second. So level 2 is still acceptable, and this is what I have done really. I showed that I worked at level 2, but I have achieved this kind of like I did intubation, I did this and this, and this is going to come with the next slide. But ideally it should be level 3 as in tertiary neonatal unit. Pediatrics department, again, you should say that this is my post, I worked here, that is evidence by post number 1, and this is the time in the post, I worked like for a year in that post, and obviously that's where you write your experience. And this is where we should. So neonatal skills, all applicants must have a minimum of 6 months experience working in neonatal settings and 6 months working in pediatrics, general pediatric settings. That's where actually that is kind of like where. So neonatal skills, if you work in level 3 or level 2, you should be showing that you have got evidence of this kind of skills. And then obviously appropriate neonatal life support qualification, you should have NLS or NRP or any equivalent neonatal life support course. And you have to show that you have got access, you have got the capability of both like intravenous lines. You are signed off for intubation and managing complications and managing resuscitations and independent initiation of resuscitation and experience of attending deliveries and to be able to independently support stabilization. And again, it should include time working on a neonatal intensive care unit. In general, this should be like a level 3 and or equivalent. But again, experience from level 2, as I mentioned, or equivalent can be considered, provided that they have gained the following skills. And these are the skills that we talk about here. That is literally from the kind of like applicant guidance. General pediatrics, you have to work for 6 months again, and you have to show that you are able to manage inpatient common general pediatric conditions, asthma, gastroenteritis, and you just write obviously the evidence that I have been able to manage these, and that post. Attendance at emergency departments, experience of initiating emergency and resuscitation care. You are not expected to manage obviously or lead resus kind of care yet, because you are only ST3 or level or middle grade level or kind of tier 1 who is going to be ready to be middle grade, and you have to have your safeguarding level 3. And this is quite sometimes can be a bit difficult for people who are applying from the outside the UK, but there are lots of online courses that you can get them done, get your certificate done, and obviously show the evidence that you have got a certificate. I have attended that course on that day, That was an online course, and I have got safeguarding level 3 kind of certification. Where are we now in terms of time? I can talk a lot, so please let me.
Still, Dr. Ammar, you still have up to 11:45. Yeah.
Amazing, absolutely amazing. So obviously,
sorry, we'll just leave 10 minutes or 5 minutes for questions at the end. Thanks.
Okay, this should be fine. So with the core competencies that's in your kind of certificate of core competencies kind of capabilities, you can see these domains. They are exactly the same domains as in your e-portfolio. If you guys have got your e-portfolio, that is obviously for pediatric kind of training, you will find the core capabilities exactly the same, and they should be signed again by the consultant, and the consultant should just put that yes means that they have got sufficient evidence. This sufficient evidence, they have either observed you, they have witnessed what you have done, or they have actually they were told about what you have done by a registrar or ANP or SAS doctor. They don't have obviously to observe all of these key capabilities, because what normally happens in the normal pediatric training for someone who started at ST1, they actually get this done and signed by so many doctors, either registrars, ANPs, or consultants. So yes, they have to put yes in each single point. You can't leave one that is empty, because this is going to be incomplete, and they will chase you up to sort it out. Otherwise, you are not going to be long listed. These the 11 domains. They are exactly the same domains as in the pediatric training core capabilities. So basically, domain 1 and 2 and 3 and so on. So this has obviously, hopefully, this has covered the area for certificate for core pediatric capabilities, which is ST1 to ST3 equivalent. This should be enough, and should be, if you have done all of this should be absolutely enough, and this should be go ahead for your next stage. So that is this is one of the most important steps that you have to focus on. The core capabilities kind of certificate, you have to get it right, and you should be get it all signed, and you make sure that you sign it, and this should be obviously enough for you to be long listed and go for the next step. Recruitment stages, and as we mentioned before, the adverts will open. That's for national round 2, guys. That opens in November. It doesn't obviously that if there is any posts coming for round 3, this would be like a different kind of like time scale, but this is what normally happens. So adverts appear at mid-November to mid-December. Be careful in terms of your application. So what I tend to do, I do not wait for the last day to put my application, submit application, because obviously sometimes you have got a bit of issues that needs to be sorted out. So the application closure day, like for example, at this point, that's 11th of December. So what I tend to do that I actually submit, or what I have done actually, is to submit it by like 9th or maximum by 10th of December, just in case if there is something that you need to complete. Because if you open the Oriel kind of website and you will start by putting your like personal details, your work details, your this and that and this. So sometimes we by mistake like do not complete a part of our application, and then you come to try to submit your application, and then it will tell you that you have to complete this area or this area, which can sometimes take a bit of time to sort it out. So I would advise, do not wait for the application closure date. Do not wait for like 11th of December, like 15 at 3 p.m. and then submit your application. Submit it like a day ahead or so that you will have some time if there is any incomplete data. And then once the application closes, there will be a process of long listing first. so that they can exclude people who has not have achieved kind of like the essential criteria, like someone who hasn't done his certificate of core capabilities, or someone who doesn't have GMC registration, or someone who's just applying and opened their application and then submitted the application without really focusing on and they do not really meet the criteria. After that, it will be the shortlisting window, and then you will be sent interview dates. So you will be sent an email saying, congratulations, you were shortlisted, please pick a date for your interview. So basically the interview window, as you can see here, it opens in March. So what I would always advise is pick your interview date as early as possible. And from the moment you actually book your interview dates, you have to work really hard on your interview, because it is not easy. It is doable, but it's not easy, and it's quite competitive as well. Um, Congratulations for being shortlisted. That's amazing achievement. Go ahead and prepare for your interview and watch as many videos and many things that as you can, and ask as many colleagues as you can. That's obviously, there are lots of resources on YouTube about the interview kind of preparation for ST3. Go through them, prepare yourself, and I would consider this interview as kind of exam. Really, it's not an actual exam, but it is because if you scored high in this interview, you will have the chance to be ranked quite high. And then if you have got a chance to be ranked quite high, you can actually choose which dinner you're going to go to. So, for example, if someone who lives in West Midlands, they have got their kids or their family, or they are even enjoying, just if they are single, they are enjoying being in West Midlands, or enjoying being in Northwest dinner in Manchester, or enjoying being in London. If you want to continue in this kind of area that you worked in, or if you want to choose an area that you would like to live in, try hard, A, to be successful in the interview, B, to actually get as high rank as you can, so that you get to choose, because you will get some preferences that you will just say that I would like to be in this area, I would like to be in that area, I would like to be in this area, and you have to like rank your preferences, and your rank will be graded against your preferences. We will come to that at the end. That's basically kind of, and then if you got like an offer, congratulations. They will give you two options: either to hold that offer or to upgrade the offer. To hold that offer means that you are just waiting. You haven't made your mind yet whether if you got like an offer somewhere that you don't want to go, or you are not sure. Some people would have applied for other kind of like training as well, like cardiology training or something like that, and they have got two offers. You can hold them for a bit of time, and then you can decide at the end whether you're going to go for it or not. And there is some upgraded line. For example, someone who hasn't achieved the desired area, that I wanted to work in this place, but I actually was granted an offer in that area, in that deanery. So what you can do is you will be given a chance to redo your preferences again, and then you can wait with upgrade, as in if there is like a space that someone did leave in that deanery that you actually left or you want. So basically your offer can be given to you in that area. We'll go again with the MRCPCH requirements. So you must have achieved success in at least 2 of the 3 written exams. So basically we know that you have got to get your full MRCPCH, you have to achieve the written exams and a clinical kind of exam. The written exams are 3 exams, that is FOBTS, and there is an exam called AQB. So you have to obviously be successful in 2 of the 3 written membership exams at the time of application, or within the last 7 years. So if you have achieved them 8 years ago, they're not going to be they're not going to be obviously you will not meet the MRCPCH requirement if you have done them like more than 7 years. Pediatric experience, we have talked about this one, and neonatal experience, and that's our lovely kind of the Oriel website. You just go to this kind of like website, create your account, and then start your application. You will have lots of obviously kind of training programs going around. We will be choosing the ST3 Paediatric training, and obviously you can go ahead with that. You will find lots of subspecialty training happening at the same time. Make sure that you choose the ST3 general pediatric training so that you can go ahead with your application. They have made some changes since I obviously did my application. They have removed the personal statement, and they obviously they kept the white space answers. However, they made like a strict word limits. As you can see here, that's how the application look like. You start like application part 1, part 2, supporting information, preference, and confirm and submit. And each of these kind of category will have subcategories. Like for example, application form part 2, you have to get all of them green like that. So training history, references, fitness to practice, competencies and eligibility, and declarations. And then if you choose supporting information, you will have different kind of subgroups really, and then you have to go through them. So it is time consuming, and it takes a lot of time to do your application. So be ready and make sure you have got what it takes really to get your application done right. I always got confused for the employment history because of obviously how our kind of like internship in Egypt work. So the way I have done it is I have done them. Obviously, our internship in Egypt is 12 a month, and you will be rotating in different subspecialties. So this is what I have done. I said I was like a house officer at this hospital, this university hospital, and I worked for these 2 months time, and so on and so on and so on in terms of your specialties that you have actually done. And there will be some gaps if there are quite a lot of gaps really. So you have to be you have to have a reason for this gap, and you have to write down that. For example, when I moved to from where I used to work to the UK, it took a bit of time. It was like COVID time, and I had to write that I was waiting for the visa and so on and so on. Shortlisting domains, I will be as fast as possible, guys. I know that I've got quite a few minutes left. So with the shortlisting domains, you have got clinical capabilities that is scored out of 8, quality improvement project relevant to application, that's out of 6, and leadership and management relevant to application out of 5, research 4+1. This means that in the obviously in the scoring criteria, which I will try to show at the end if we have got any time, you can achieve like an extra point. Teaching relevant, that is 5+1. So basically, if you calculated this, they will be 30. And this application is being kind of like assessed by 2 assessors. Each one of them will grade you out of 30. So the total will be 60, and then there will be like a short listing kind of cut-off. So for example, like if you scored in your application like 40 and your cut-off is 41, you are not going to be shortlisted. If you scored 41 and your cut-off for kind of like grade for shortlisting is 40, you obviously are going to be shortlisted. It doesn't matter, it's not going to count. So if you got like 60 out of 60 and someone got 41 out of 60, both of you guys will go ahead to the next step, which is the interview, and it will not count even further. So you'll have to obviously prepare for the interview from scratch, and you are going to be ranked in the interview in a different way really. And I have got few tips really. I wish I would have more time to go through each of these lovely kind of 5 points, but we'll give like few tips really, because it is quite important how you write them. You might have done like an amazing quality improvement project that was published somewhere in the world, and you have done amazing job doing that, but you haven't presented it right. You haven't written them in the right wordings. So you will not be giving 6 out of 6. You can write, you can present your quality improvement project exactly the same that you have done in a different way, and obviously and you are not giving the 6 out of 6 in one of them, and you are giving 6 out of 6 in one of them. You could score 1 or 2 out of 6, and then if you rewrite your kind of like your work, you presented your work in a right wordings, then obviously you can get 6 out of 6. And this will be huge really in terms of shortlisting domains. As you can see, if you are not, if like one grade only can make like a massive difference between you being shortlisted, going to the next step, or you are not going to be shortlisted, waiting for the next round, which is going to be a bit difficult. That is the difference, is how you write your application really. So that is really important, guys, to focus on these white space kind of answers. In terms of key clinical capabilities, be very clear. Some people would like to, and I will be very honest with you, some people would like to write or use AI to try to choose the right wordings or so and so. You have to be, obviously, it should be very clear that it is your kind of like genuine experience, that it is what you have done. In terms of, some people sometimes read what other persons have written, but we are not the same. I have got so and so experience. I've worked in this place and that place and this place. My experience is not going to be the same as this person or that person. You should be writing, and it doesn't matter if you have done like an amazing kind of like research scenario, for example, and you have got ROSC at that minutes of age, and the patient was admitted to PICU and they are doing amazingly well, or you have only just reflected on like mislabeled blood sample or something. So the scenario itself doesn't matter. The way it matters, that the way how you present, how you write it right, how you reflected on that kind of scenario. In terms of QIB and audit, you should be focusing on identifying. It should be very clear in your.
I have 10 minutes left.
So I'll be as quick as possible, Mahmoud. I promise. I think I've got. I know that I
Yeah,
just want
you
to see that.
you can get 2 minutes to finish if you have
Right.
just left some time for
Right.
questions.
Sorry about that. So yes, so I'm more than happy to be contacted, guys. If you want to contact me further for any advice, I'm quite happy to do that. So in terms of QI or audit projects, it should be clear that you have identified a problem, you implemented a change, and you did show some learning. Teaching experience, you could have given some bedside teaching, or students or nurses, or feedback, or given a bit of feedback for like a teaching project that you have done. And obviously, if you did like a departmental teaching, it is not going to be graded the same as, for example, you have designed a teaching program for example, GP trainees to master the NIP examination. At this point, you have designed your teaching, you have delivered your teaching, and you reflected on that teaching, and you were given feedback by GP trainees. So yeah, it has to be in a way, and I would really advise you to go through the scoring kind of points. Leadership, you should show some initiative. You should show that you have been involved in MDT work, and you can obviously show that you can actually escalate to a higher kind of like seniors if you obviously if you need it. Research, I know some of you have done master degrees, or it can be anywhere, like case reports, posters, or journal clubs. The high scoring answer, be very clear. Show as much reflection as you need. You can write, and this is what I was told by one of my colleagues before, that actually you can write a very simple kind of scenario, but the way that you have learned from that scenario, the way you reflected on that scenario, that's the most important bit. The common mistakes, vague answers. they are not sure if you have done this or if you or someone else has done it. Was made like this QIP. We have done this QIP. We have kind of. It should be very clear that I have done this. If you have done it, of course, I have. I found this, and I wanted to do this. I wanted to do that. So it should be very clear. And if you haven't shown any reflection, it's not going to be counted. And make sure that you do not go beyond the word limit. Interview format, as we mentioned before, that's 40 minutes interview. It is 2 stations, 17 minutes each. We can have like a lot of talk about it, the interview later. I will try to go as much as I can. So with the communication station in the interview, be quite empathetic. Let obviously the person or the parent or whoever the role player to talk more than what you talk. Be quite safe. Don't give like information that you're not sure about. With the clinical station, always go be A to E kind of assessment. Make safe decisions. Seek senior help, and don't forget to obviously update the parents. Make sure you update you obviously prepare your interview quite early. Make sure that you do a bit of mock interviews with your kind of like colleagues or senior colleagues who have done the ST3 kind of situation before. Make sure that you give structured answers. It will be very clear to them who actually have got structured approach, or someone who's just, they are quite experienced, but they're not very structured. So they would give higher grades for someone who has done this. Referees, you should have 3 referees, and ideally should be your educational supervisor, and they should be contactable and approachable. It's not going to help if you've got a referee who is not going to reply to your thing, to their emails. Reasons for rejections, eligibility failure. You haven't done something very important, like we talked earlier, weak answers or unsafe interviews. The preparation time, that what I would like to say is 6 to 9 months, and it is what is obviously advisable. Drafted answers as early as possible, and obviously once you get to be shortlisted, make sure you have done amazing preparation for your interview. Thank you guys, and these are my resources. Hopefully that is my last one. Any questions?
Thanks, Dr. Ammar.
Sorry.
Now we have a couple of questions on the chat. I think the first one is, if someone has MRCPCH and 17 years of pediatric experience with a GMC registration, shall they apply for ST3 or no?
100%. So go for it. Obviously, if you want to go to pediatric training, that's going to be, obviously, you have got full MRCPCH, and this will give you a bit of like more kind of points, I think. This is what has happened with my application. 17 years of experience. Have you thought about CSR? We have got amazing talk from Dr. Gouda in a second. So yeah, so go for it if you want.
Yeah. And the other question, thank you for your presentation. Can you please give us more tips on interview preparation? So I think Dr. Ammar has given already lots of tips, but I think people might need more information about how to prepare, maybe about the group preparations, mock interviews, and similar stuff. Do you advise anything special?
I'm more than happy to, obviously, because as you obviously know, that it is going to take like very long time really to go through it is not like an kind of like an easy preparation. Prepare as if you are going to do an exam. There are lots of resources online on YouTube that you can find, like you have got kind of soft landing people. Every single year they will do lots of like meetings that you can find them recorded on the internet. And if Dr. Mahmoud wants, or you guys want more kind of session that we can talk about interview, I'm quite happy to do that for you as well.
Yeah, there is another question as well. After MRCPCH cleared, do we have full registration for GMC or a specialist registration?
Specialist registration, you will get it only if you have got obviously your CSR or obviously CCT once you finish your training. The word specialist is a bit deceiving. In other countries, specialist means that you're just a registrar. In the UK, being on the specialist register means that you are a consultant. So after clearing your MRCPCH, passed your OET, which is the English exam, you can actually apply for GMC registration.
Okay. Thank you.
Thank you.
Thank you, Amar. Thank you. It's very helpful tips. I would say I understand that you have short time to do that, and actually we are willing in PPAN to prepare for workshops. I think application and interviews needs like small groups practicing lots, and we are aiming to start to prepare for that. But thank you so much for your time and for sharing your experience.
Thank you so much.